Hi, hello, welcome to Future Nurse YouTube channel. Please subscribe and support our YouTube channel. So, friends, this video is containing only questions only. So, this is like practice test questions. Okay, so let's start today's video. So, the first question is: a nurse is caring for an anemic patient. What finding should suggest her that it is acute blood loss anemia? So, options: exertional dyspnea, easy fatigue on exertion, bradycardia at rest, postural hypotension. So you can comment your answers on the comment section. So this is like the practice sessions. So next, which patient is having very high risk for developing ovarian cancer? So options: 30 years old on oral contraceptives, 36 years old who had first child at 22 years, 45 years old who has never been pregnant, 40 years old who had children and one abortion. So who had 5 alive children and one abortion. Okay, so next, which joint movement is restricted in a patient with pericapsulitis of shoulder? So options: adduction, abduction, flexion, extension. Okay, so move on to the next question. Maternity nurse must be aware that screening for diabetic mellitus in pregnancy is done at. So options: 6 to 17 weeks, 18 to 23 weeks, 24 to 28 weeks, 29 to 32 weeks. So please comment your answers. Neonate of diabetic mother is at risk for all the following except hypoglycemia, hypocalcemia, hyperglycemia, hyperbilirubinemia. Okay, so next, so move on to the next question. Before giving blood transfusion, a nurse must note the date, time of collection, must be aware that packed RBC can be stored up to. So up to. Options: 25 days, 35 days, 45 days and 55 days. So please note and comment your answers. A nurse was called to see a patient with noisy breathing. She suspects laryngospasm with stridor and it occurs commonly with. So options: hyperkalemia, hypercalcemia, hypokalemia, hypocalcemia. So okay, next question. Nurse working in an operation theatre OT must know the risk of HIV infection with needle stick injury about. So options: 1:100, 1:200, 1:300, 1:400. Okay, so move on to the next question. A nurse is caring for a patient with swine flu and she has to give the drug of choice for swine flu, and it is, so drug of choice is acyclovir, adafovir, cidofovir, oseltamivir. So drug of choice for swine flu. Okay, so move on to the next question. A nurse is caring for a patient with DVT, deep vein thrombosis, and she must be aware that venous emboli will be lodged in. So options: options are heart, lungs, liver and kidneys. So please comment your answer. So next, hyaline membrane disease of an infant is due to deficiency of surfactant, and the source of pulmonary surfactant is So options: alveolar macrophages, capillary endothelium, pneumo new monocytes, type 2, type 1 pneumonocytes, type 2. So next, which of the following is a sorry which of the following is a DNA virus? So please comment this answer: DNA virus. Option A, hepatitis A, hepatitis B, hepatitis C and D. So which of the following is a DNA virus? So next, to do percussion and postural drainage of lungs in bronchiectasis, what body position of the patient nurse should use during postural drainage of lungs? Supine position, prone position, decubitus position, semifolars position. So position you need to answer here. Okay. So next, so moving on to the next question. Patient on enalapril and diuretic therapy for heart failure. Nurse should notify the physician that the therapy is not effective when she finds. So what she finds? So options: dry cough, skin rash, edema legs and postural fall in BP. So okay. So next question. 30-year-old patient has an ulcer over lateral malleolus. Nurse caring for this patient understands the pain of the patient is due to. So is due to edema, exudate, infection, ischemia. Nurse caring for a retropositive patient with molluscum contagiosum. This secondary infection is caused by. So which of the following virus? Pox virus, papilloma virus, Epstein-Barr virus, herpes simplex virus. So you need to mention the virus name. Nurse is about to insert Rayleigh tube RT tube for a patient. Before this act, she must be aware of the distance between the incisor, teeth and gastroesophageal junction. Which of the following is correct distance? 30 cm, 40 cm, 50 cm and 60 cm. So you need to answer this. Okay. So next, a nurse can decontaminate the HIV contaminated waste products with all the following except formaldehyde, methanol, glutaraldehyde, sodium hypochlorite. So next, 25 years old male patient had sweating, palpitations and found to have blood sugar of 45 mg per dl. Multiple similar episodes had been recorded in the past, corrected with glucose. Nurse caring for this patient should consider which of the following diagnosis? So VIP oma, insulinoma, gastrinoma, glucagonoma. So please comment your answers. Nurse is about to catheterize a bladder of the pregnant lady. She should be aware that all the following facts about female urethra are true except. So options: it is about 1.5 inches in length, it's posterior to vaginal orifice, it pierces through urogenital diaphragm, it is straight and offers minor resistance for catheterization. So friends, please comment your relevant answers. Okay. So we have come to the end of the video. So please subscribe our Future Nurse YouTube channel for your upcoming nursing officer examinations and also AIIMS NORCET in 2024. Thank you.